Understanding the average length of stay of a patient is very essential for a healthcare provider. Each hospital would have their own SOP and protocol that a particular patient for so and so surgery or so and so condition should be here for so and so period. So if this period is getting extended, then the management need to be concerned. What are the causes for this delay for a patient to be admitted for more than the stipulated period? So there are so many reasons to it. Either the patient's health condition is complicated. There are other reasons as well, the operational reasons. So for example, if a nurse on duty or if the clinician on duty is not handing over the protocol or the patient's details to the next stakeholder on duty because their shift timings are being changed, then what happens is that there would be a delay in shifting the patient from a ward to an ICU or ICU back to ward, or the patient has to be discharged. All these communication would be delayed slightly. Even in state of discharge, you have to tell the patient attenders. Usually any hospitals will follow this. They will tell the discharge way ahead. So any hospital for this particular reason will have their own grace hours. Why is this grace hour provided? So for example, a patient is getting admitted today around 12 noon. So till next day's 12 noon, it's considered as a single day. So what happens if there is a delay? Would it be considered as 1 day, 1 hour, or it's considered as second day? So this is the exact reason why hospitals would have grace hour, or because the delay from the patient attenders, they can be delayed from patient attenders. So 2 to 3 hours of grace times are usually given by hospitals. Again, this varies from hospitals to hospitals based on their standard protocols followed. So the more number of days a patient stays in a bed, more worried should be the hospital. Hospital should be worried because cause some trust issues between the hospital and the patients. So what can you do in these sort of situation? So that is why you need to have clear key performance indicators on the average length of stay, understanding which patient has taken more number of hours in a particular bed. So you need to go and talk to the patient attenders, saying like, this is the reason for the delay, what could be done. You have to clearly communicate. Understanding this average length of stay will also help the management to take key decisions.